Welcome back to Your Health in Your Hands. We are talking about sickle cell disease in Nigeria, and we're going to continue with Rabi. Rabi is an interesting one. She's a sickle cell warrior, but she's also a warrior of warriors. In other words, she's devoted her life to helping, through her foundation, to helping children with sickle cell disease all over Nigeria. Ask me how she does it. I have no idea, but we're going to find out very, very, very soon. Rabi, thank you again for coming.
Thank you, doctor.
Right, so you've had to live with sickle cell disease.
Yes.
For a long time.
Yes.
Tell us your story.
Well, I was born a normal child, and as a baby, I didn't look like anything was wrong with me or was gonna be wrong with me in the future. So I was very healthy, very, chubby and all that. I didn't have any, symptoms of anything. At about 6 months, and then it started. And
which, by the way, is the time it kind of starts.
Exactly.
About 6 months when
and then I started.
Fetal hemoglobin levels drop.
Exactly.
And then, like, the normal adulthood.
I started crying too much, fever, on and off. And then my mom, of course, was very worried. Treated so many things, malaria and all that.
They didn't know about sickle cell disease.
They didn't know about, of course.
Okay.
And then eventually she met a white lady who advised her to actually have a test, and find out what is really okay. I developed the hand and leg syndrome as well. And of course, it was in the 80s. Of course, my parents didn't know anything about such problem. So
where were you living at that time?
Okay, yes, I was in Jos at that time.
Okay.
Yes. Then we now went to England, and then at the Royal Free Hospital, London. And then that was when I was diagnosed with sickle cell.
At what age?
At about that time. 8 months, about thereabout.
Okay.
Yes. And then the story started. My mom was like, I've never had this. And they said, yes, you haven't, because only a few people know about it, and it's actually preventable. But as it is now, you already have a child with it. So they started mentoring her and counseling her while I was getting treated, and she learned a lot. Over the time we spent there. At a point, she was even given, she was appointed as a counselor in the hospital to talk to other parents, right? So over the months, she started talking to other parents and encouraging them. Well, all because, we thank God, I come from a privileged home, so I got a first-hand treatment and and mentoring. So she now became very, very aware of what is actually wrong with me, and then she was an expert from beginning on how to manage me. She decided that, okay, this is who I have as a child, and I'm going to train her to be a very strong person and to live with this problem, Right. And then she told my dad the story, and that increased his love and attention to me and all that. So I was more like everybody was watching and had eyes on me and was trying to prevent me from, any other harm that would come my way.
So you were given a lot of care, but at the same time they tried to make sure you were also strong.
Yes, and especially my mom. That was the part she played.
Did they sort of give you too much, like, how in the Yoruba they pamper you and keep
my dad was on one side doing that, but she was on the other side reminding him that this is what it is, she needs to be strong.
Because I had a patient come to my clinic, and his older brother, he's 28, his older brother is 29, and the older brother was the one filling out all the forms for him, and they're treating him like he can't do anything.
No.
That wasn't your case, right?
That wasn't my case. My mom was there to remind me, you need to stand up from
for
this
yourself. I think
bed.
that's really important.
Yes, and
Very
you,
important.
you are a normal person. This is just a crisis. It keeps coming on and off. My dad was, on the other hand, getting very hysterical. If he takes me to the hospital and a doctor doesn't treat me in, if I don't get well in 24 or 48 hours, he goes, if you can't treat my daughter, you need to let me know. I have other places to take her to, and then he drags me. And my mom was like, you need to calm down. This is a phase she needs to pass. 3 days, 7 days, the crisis will go on its own and she'll be back to normal. And he'll go like, no, I don't have that patience to wait, I need to know, is this something the doctors can do or not, So actually I was taken from one hospital to the other. Anytime I have a crisis, it's either I'm in America or I'm in, somewhere, he wants the best hospital for me and the best treatment for me all the time. So it's only my mom that usually asks him to calm down, and anybody can manage her. I can manage her. She usually tells him that in her words. So, and then I grew up with the two balancing, and then I realized that, okay, I'm actually normal until I fall sick.
Now, were you having crises on a regular?
Yes.
How regular?
No, it wasn't on a regular basis. My problem was, in fact, I wasn't even anemic. I've never, as a child, I don't think I've had a blood transfusion,
Okay.
Then my major problem was the fact that I'm easily get infected, so I have to watch my environment, and then my bones are my major challenge. I've developed osteomyelitis so many times over the years. That was the major thing that was affecting me, and I've had multiple surgeries with those.
Tell me about that. You've had some hip. Do you have a hip replacement?
Yes, I've had a hip replacement. Okay. I have had osteomyelitis in, I think, almost all my bones.
Almost all your bones?
Yes, because initially that was what the problem was.
Okay.
After the fever and all that, I was infected already and all my joints were swollen until I got a proper treatment. They said they wanted to have a surgery in all the joints, and that was when the white lady came in and said, you can't operate a child with multiple osteomyelitis and say you want to drain the fluid, so
sense.
take her where it's necessary. So they took me to London, and with just antibiotics and proper care, I escaped that multiple surgeries until as a teenager it came back on one of my legs, and then that's when my surgery started. So most times the joints just swell up, I have osteo, and of course I have to go to a surgery, and that's how my story started. And
wow. So in your case there was a lot of infections and osteomyelitis.
Yes.
And that's a big thing, as you know, that we really try to promote as much as possible. First thing I found out, that first thing we need to boost the immune system.
It's the immune system, yes.
Because once you can strengthen, especially in this our tropical region in Nigeria, where you have malaria, typhoid, salmon, all kinds of things coming at you. If you strengthen these kids, adults' immune systems, you can raise the threshold for those infections, crises, and all those things. So very, very, very important. All right, our time is up for this segment. We will be right back. Don't go away.